Today our topic, last organ which take part in respiratory system is lungs. Okay, we're going to talk about the lungs. Okay, first if we'll talk about the lung, we are gonna talk first function of lungs, second parts and surfaces, then we will going to talk about the margins, then we will going to continue our talk pulmonary, loops and segments. Okay, then we going to talk about the pleura, its parts and races means narrow spaces. Okay, this is our today topic. First we need to talk about the functions. This is the lung. First, lungs is the essential organ of the respiration. Essential organ of respiration. But it's not only lungs take part in respiration, also muscles of respiratory, we also have respiratory muscle which also take part in respiration, like muscle of inspiration, which expand the lungs and decrease the pressure. Which muscle we have? First we have diaphragm muscle, then we have external intercostal muscle, and we already discussed this muscle in myology. Okay, intercostal muscle. Okay, then we have accessory muscle like sternocleidomastoid muscle in neck muscle, next superficial group of neck muscle, sternocleidomastoid muscle. Okay, these the three are the inspiratory muscle. We also have expiratory muscle means take part in expiration muscle. We have internal intercostal muscle and abdominal muscle or abdominal group of muscle. Okay, these muscles which take part, that's why I told lungs, not only lungs are the essential organ of respiration, also muscle which take part in respiration, like muscle of inspiration and muscle of expiration. Okay, these are the example of the inspiration and expiration. Okay, this only talk about the general about the lungs. Okay, if we talk about the function of lungs, okay, first we will take the function unit of lungs. If you will take any alveolar sac, okay, first we will take only one alveolar sac. Okay, and alveolar sac is highly vascularized. Okay, and they oxygen coming to the bloodstream and excrete or wasted carbon dioxide. Okay, these are the function of the function unit of the lungs. Okay, alveolar sac. Okay, now we need to talk anatomically about the anatomy of lungs. If you talk about anatomy of lungs, first we need to know about the parts of lungs. What is the part of lungs? This is the right lung, this is the left lung. Okay, which okay, if you talk about the right and left lung, here is the apex and here is the base. These are two parts of the lungs, means two parts of lungs. First is apex and then we have base. Then we have surfaces. Which fasces, like in Latin language, fasces and surfaces. We have 4 surfaces in lungs. Okay, surfaces which faces the surfaces. We have 4 surfaces. First we have inter or intercostal surface, intercostal surface. And intercostal surface meanings, you know, like toward the coastal. Coastal means rib, toward the ribs, because here we have ribs, and this lungs faces the are toward the ribs. Okay. Second surface we have diaphragmatic surface. Diaphragmatic surface or fasces. These are the diaphragmatic surface. Okay, this one, because here we have diaphragm muscle, it's toward the diaphragm. That's why it's called diaphragmatic surface. Okay. Third we have mediastinal surface. This area, this is a mediastinum area. Okay, mediastinum, and this is it's called mediastinal area. Mediastinal area. If you will talk about the mediastinal area, I will continue about the mediastinal. And the fourth surface we have interlobular surface. And interlobular surface, you can see from the lateral view of the lungs, you can see where the separation of lobes of lungs. Okay. Now if talk about little about the mediastinum, because I told about the mediastinum. If you need to know about the mediastinum, what is mediastinum? If we talk about the mediastinal area, mediastinal surface is very important, because you know mediastinal surface. Now I will show what is mediastinal surface. No, mediastinal area, if you know where the bronchus, we know this is the trachea. Okay, and trachea will divide into the bifurcation where the cornea of the trachea is divided into two, right and left main bronchus, and this right and main bronchus are when they are entered into the lungs. Okay, this area is called helium of lungs. Okay, helium of lung, if you remember. Okay, where this is the helium of lungs, we are interlobular to the lungs. Okay, and this helium of lung is covered, and helium of lung where the entry of the enter bronchus. Okay, for memorization you need to remember what is helium of lung. Okay, and this helium of lung is covered by what? Covered by pulmonary ligaments, and here also we have, you can say, is the root of lung. Okay, root of lung. Here's other important information, okay, about the helium of the lungs. If you talk about the, because here helium of lung, we have the bronchus, which I told. Okay, for memorization, if you helium of lungs, this is about the mediastinal surface, and mediastinum, about the more detail I will tell about the mediastinum. Okay, we also have mediastinum topic, and we will continue about the mediastinum, what we have superior and inferior, and then inferior have division into other three. Okay, now if you talk about the, we already talked about the parts and surfaces. Now we have margins. We have two margins. This is the inferior margin. If you talk, this is inferior margin of lung, inferior margin, and this is the, this one, where mediastinum, this is the anterior margin. We have two margins. We have inferior, two margin we have, inferior and anterior. And what about inferior? You know, inferior, what we do? Inferior do separation of a intercostal surface from mediastinal surface by diaphragmatic surface. This is the work of what? Inferior margin. Inferior margin separate the intercostal surface which toward the ribs, and interlobular surface, mediastinal surface from what? By diaphragmatic surface. Okay, these are the work of inferior margin. And interior margin, you know, interior margin here, if you remember, About the lungs, you know, these are two lungs, this lungs, okay. Here I will also draw lungs. This is a lung, okay. If you talk, this is the right we have 3 loops, and here we have 2 loops, okay. If you look from the laterally, okay, we have fissures, okay. Here we have oblique fissure, which separate the loops, okay. And we have oblique in right lung, okay. We have oblique, and this one is a horizontal fissure. We have 2 fissure in right lung and 1 fissure in the left lungs, okay. This is about the fissure which division the loops. Then we will also continue about the pulmonary loops, how many loops we have, okay. Now about which I told about the anterior margin, you know, the shape of the lungs, okay. The shape of the lungs like this, okay. The right lung is symmetrical, but the left one is non-symmetrical. Why? Because if you know, the heart is location in the middle, in the midline, in the medium. Sorry, in the midline is a location of the heart, but its apex is toward the left side. If I mean to tell you about, for the heart, there we have incisura, there we have notch in the left lungs. It's called cardiac notch. Here we have notch. For heart, it's called cardiac notch. And also cardiac notch are limited by pulmonary tissue, which is called lingula of lung. Okay. This is means here we have cardiac notch, and here we have lingula of lung, okay. This is about the anterior margin, okay. Inferior margin, I told what we have separation of intercostal surface from the mediastinal surface by what? Diaphragmatic surface. And anterior margin, you know, the shapes of the lungs, you know, interior right lung we have symmetrical, but the left lung we have no symmetrical, because there we have notch for the cardiac. For heart we have notch, it's called cardiac notch, and there is we have area which limited by a pulmonary tissues, it's called lingula of lungs, okay. This is about the margins, parts and surfaces, okay. Because this is anatomy, and anatomy is very, because we are also discussing human anatomy, and we need to know the structure of the lung, okay. Then we have pulmonary lobules, okay. If we talk about the pulmonary lobes, then we need to know about the each lungs, okay. If you look from the laterally shape of the lung, okay, lungs from the laterally, okay. And here the helium of the lung, okay, here we have, I told in the left kidney we have the fissure, it's called oblique fissure, which separate the loops, okay, oblique fissure. But in this is only in left lung, okay. But in right lung we have 2 fissures. One have here, and this is the here, okay. One is horizontal fissure, this is horizontal fissure, and this is the which fissure? This is oblique fissure. Now start from the right lung. Now right lung we have 3 loops. Three loops. First one we have superior lobe. Second one we have middle lobe. This one middle lobe, M, S and I. It means superior, middle and inferior. Middle lobe. and third we have inferior lobe. Okay, and if you talk about the left lung, and left lung we have only one fissure, which I told, which a division only by one fissure, which is oblique fissure. Which division? Because here we have incisura for what? Cardiac. Okay, left lung we have two lobes, superior and middle lobe. Superior lobe and inferior lobe. Okay, now the last part in lungs, okay, we have pulmonary segment, and this segment are very important. Why we are talking about the segment? Okay, first I need to tell you about the segments, because we have pulmonary segment, and pulmonary segment is very important in surgery. Okay, very important. You know why is important segment? Because for example, if there's, this is a lung, if there's some tumor, like some tumor attack in the lungs, okay, if we know the segment of the lungs, then we know just surgeon do to remove only the dead area where the tumor is located. Means they will remove only the dead area or dead segment where we have the tumor is location, and other area or other segment are safe, and other lobes of the lungs are safe. This, for these things we need to know the segment. That's why we have the right lung we have 10 segments, okay, and left lungs we have 8 to 9 segments. Okay, if you talk about the right lungs, okay, and for the segment we need to know from the lateral or middle view of the lung is very important. Okay, if you know about the superior lobe, we have 3 segment in right lung. Okay, middle lobe we have 2 segment. Okay, and inferior lobe we have 5 segments, because in right kidney we have in right lung we have 10 segments. If you talk about the left lungs, we have 2 lobes, superior lobe. Okay, superior lobe we have 4, and inferior lobe we have also 4 segments. But in some patient we have 4 or inferior 5 segment, because I told we have 8 to 9 segment. Okay, these are the information about the pulmonary segment and about the lungs. Okay, about right and left lung differentiation and surfaces, parts, okay, margins. Okay, and then we will continue about the second parts of our topic is about the pulmonary segment, which I told, like about the right lung we have 10 segment. Okay, about the superior, middle and inferior lobe I already told. Now I will mention where we have the segment. Okay, superior lobe we have 3 segment, which I told, 3 segment. We have apical segment, the first one, apical segment. Second we have posterior segment. Okay, third we have anterior segment. Okay, then in the middle lobe we have 2 segments. Okay, we have we have lateral segment. Okay, then we have 5, we have middle segment. Okay, then in the inferior lobe, this is middle lobe. Okay, ML is middle lobe. Okay, in the second. Then we have inferior lobe, which I told you we have 5 segments. Inferior lobe, 5 segment. First we have this, we have superior segment. Okay, 7 we have inferior basal segment. Inferior segment. Okay, then we have anterior basal segment. interior basal segment. Okay, okay. Then we have lateral basal segment. Okay, and then we have medial segment, medial basal segment. These are the 10 segments which are in the right lungs. Okay, here you can say this is the lateral view. Sorry, this is anterior, and this is the lateral view of a lung. Okay, here we differentiate the loops, segments of the right lung. Okay, this is very important for surgery, because which I told, like if the patient have like if patient we have like any type of cancer. Okay, and if we are located in the superior loop in any segment, then the doctor only remove the dead segments and the other area will be safe. Okay, now we will discuss, we are going to talk about the left lungs, which we have 8 segments. Okay, left lungs. We will first draw here the interior view of left lung. Okay, here. Okay, if you got, we already know in the left lung we have 2 loops. Okay, superior and middle, and here we have lateral view. If you know, here is the helium of the lungs. Okay, this is about, we'll talk about the left lung. Left lungs we have 8 or 9 segments. Okay, and we have 2 loops. Okay, superior and middle loop. If you talk about here, first we need to know this. Okay, because each segment we have 4 loops. Okay, these are the 4 segments. First we have apico posterior segment, posterior. Okay, then we have the second, we have anterior segment, then we have superior segment, superior lobe of left lung. Okay, and fourth we have inferior segment. Okay, then if you talk about the middle lobe, this one, so inferior lobe, we also have segment, other 4 segments. I will write here. We have basal, anterior, basal, posterior, anterior, 5. Okay, basic, posterior. Okay, and then we have lateral, medial basal ligament. Okay, and lateral basical ligament. These are the 8 to 9 segment in the left lungs. These are about the pulmonary segments, which are very important in surgery. Is again I already told you many times about the segments. Okay, it's very important in surgery.